employee.
Yeah, they're going to do one he's 45 years old male patient.
I am a totally a government employee. My concept of coming here is not a teaching program. My concept of coming here is to introduce what is a heart operation, and this operation is done in this state of Jharkhand. So you need not send the patient outside to Delhi and there is a lot of fashion of sending the patient from this place to CMC Vellore. There is no need. We are doing in and out a lot of surgeries free of cost. Any patient coming to me, if it comes to me with Ayushman scheme, with Ayushman card, it will not be charged even a single rupee. So I am going to tell you, this is our setup in the Giridih Institute of Medical Sciences at RIMS. We have a model roti, very high-tech roti, and we are doing all sorts of the heart operations which are possible. This is one heart operation. In 10 minutes I am going to demonstrate the heart surgery, how a heart surgery is done. It is a mitral stenosis, which is a rheumatic heart disease affecting the mitral valve of the patient to cause the stenosis, what is known as mitral stenosis. So we open the abdomen of the patient. We will open the chest of the patient with chest of the patient is to be opened with the sternotomy. This is the fracture of the sternum with a saw. This is the same saw which a carpenter is using to cut the wood. So it splits the sternum into two portions. It is a mid-range sternotomy, and this sternotomy we approach each and every chamber of the heart with great ease. If you open the sternum with the self-retaining sternal retractor, what you see in front of it is a pericardium. Underneath is a very beautiful heart, but this is a diseased heart. The aim of this is to correct the heart lesion, which is a mitral stenosis. See, the valve is damaged. The blood is unable to flow from the left atria to the left ventricle because of the stenosis. There is back pressure changing in the lung, and patients are having increased lung pressure than pulmonary artery hypertension and right side failure. So we create an artificial circuit in the operation theatre, what is known as cardiopulmonary bypass. This is a big cannula which is put into the aorta of the patient, and this cannula is attached with the heart-lung machine with the bypass circuit, and the oxygenated blood from the heart-lung machine will go to the body because we need to stop the heart. And these are the two venous cannulas, one is in the IVC and one is in the SVC. So the blood is drained by these two venous cannula, gone to the heart-lung machine, which I will show you. The heart-lung machine, it will get oxygenated there and pumped back into the body by this aortic cannula, that is known as cardiopulmonary bypass. So we create a state of artificial death in operation theatre. So what is the definition of the death? As you know, it is the cessation of the respiration in the heart is known as death. So an artificial medical death is created in the operation theatre for 2-3 hours. And this is the heart-lung machine. This portion is known as the lung, and this portion is known as the heart. The blood is coming from the body through the SVC and IVC, drained here, get oxygenated through this membrane oxygenator and pumped back through the aortic cannula which I put the first. And in that process we have isolated the whole body blood into this heart-lung machine, and the heart will be stopped by pushing in a very high concentrated solution, cold blood solution of high concentration of the potassium, which we call the arrest of the heart in diastole. Now you see a high potassium solution will go through this cannula and the aortic root through the coronary and distribute into the various cells of the heart, and the heart will stop in diastole. So this is a cardiac arrest. Right now there is no life. If you see the monitors at this stage, all the lines will be flat. There will be no ECG and there will be no arterial pulses. And the heart is stopped. So if the heart is stopped, then only we will open the heart and repair the various defects of the heart. Otherwise it is impossible. So I have opened the left side of the heart. What you see is the mitral valve, which is stenotic because of the rheumatic heart disease. I cut it at 12 o'clock position. So this is the left atria, and down what is there is the right is the left ventricle. You see the mitral valve is getting detached. Upper one is known as the anterior mitral lymph. It is getting detached from the annulus. You can appreciate if you keenly see there are some cardia and the papillary muscle. As you know the anatomy, There is some cardiac and the papillary muscle which get attached to the left ventricle. So this diseased valve is there, which is stenotic because of the rheumatic heart disease, which is very prevalent in our country and in so many developing countries. But this is not the disease of America and UK. Though there are developed countries, those countries don't see this type of the disease. I have tons of patients. So many patients are in the misery because of the rheumatic heart disease in the India. So see, I am cutting the cardia here and detaching this mitral valve annulus, this whole the artificial prosthesis. So, and everything is only possible when the heart is stopped and the chamber is open and the whole blood of the body is deviated in the cardiopulmonary bypass circuit, and this life is going on. Practically, there is no life. If you see from the monitor point of view, it's everything is straight. So this is the mitral valve which is excised. If you see the anatomy, this valve is quite thickened, the leaflets are not pliable. You see at both the edges, the commissures are fused, and if that red color upper side, you can see that is the calcification. So it is a very small orifice from left atria to the left ventricle, and that upper portion is a calcification and is a thick and rolled out edges. That is very classical of rheumatic heart disease. So this stenotic valve is to be taken out. Now how to replace this valve? We have to put a prosthetic valve. There are so many prosthetic valves which are available in the market. They are made up of metallic tissue and the biological tissue. Accordingly, there are so many indications which valve is to put where. So certain sutures are being fixed at the mitral annulus level, and a prosthetic valve as a size of our shirt, like XL, XL or 2XL, different sizes are there. So we size what size appropriate for the heart, and we choose the valve and put it. See, this is the heart lung machine again showing whole operation is going on. So this is the sizer. I am going to size the mitral annulus what size. So valves come 25, 27, 29, 31, 33 number size. You choose it. I think whatever is the size 27. So I will ask our nurse there to open the 27 number prosthesis. So I have judged it. She is opening the prosthesis here. This is a metallic prosthesis. So this is usually majority of these various companies are there which are all from abroad, but we are in India and Kerala. There is the production of TTK Chitra valve, Indian valves, very good. This is the Indian valve, Chitra valve, which is which we are using in this patient. So it is a one-way valve. As the definition of the valve, it allows the blood from in one direction, not from the opposite direction. So this we are going to implant. There are so many implanting techniques. So in other words, this whole operation is only possible until and unless you stop the heart. And how to stop the heart is without the help of this cardiopulmonary bypass machine, what is known as heart lung machine, this operation is impossible. The idea of showing this thing is that these are the very, very ordinary operations which are being done in rings in and out. So please tell your patients, whosoever is coming to the clinic, there is no need to fly to Mumbai or some other places for these operations. These operations are daily done with great ease, and everything is being paid under Ayushman scheme to the patient by the government. Nothing is to be paid by the patient. Refer the patient to a government institution in our state. No need to send the patient outside. Now you can see. Now this valve, I am fixed that valve to the all the sutures which I have taken at the mitral annulus level. I will push the valve into the heart and suture it to the mitral annulus. So I will put a prosthetic valve in the anatomical position of a diseased valve which is already taken out. You can see there is no movement of the heart. Heart is flaccid organ right now, and all the chambers of the heart are open. How it is possible in life? Until unless there is a machine which is there known as a heart lung machine which will stop the heart, so that this operation is the reality. Otherwise you cannot do this operation. So the valve is in position. I am checking whether the valve opening and closure is fine or not. After that I will close the heart. Now it is a time to come back to the life. My operation is done. It has taken 2 hours for me to do the surgery. There is atrial fibrillation. Some mild clots were there in the left atrial appendage which was taken. Left atrial appendage was ligated or amputated. Now I close the chamber of the heart. Now I am squeezing the heart manually so that if there is any air which is entrapped, during the opening of the chambers will come out, otherwise it will go and embolize into the brain and cause strokes. So I will release the clamp, I will squeeze it manually. This is known as a de-airing. So I will de-air the heart so that heart will not allow even a single air bubble. Otherwise, when it go back to the circulation, the air will go into the brain and cause the changes. Now the heart is fibrillating. When the reperfusion is going on, now the life is coming back. Right now, this is the defib pads. As you are using external defib pads, these are known as internal defib pads. Here 30 joules of energy is quite enough to convert this thing into a sinus rhythm. Right now you can see the energy, 30 joule energy is given, and the DC shock is given to this patient, and this patient will come what is known as a normal life of sinus rhythm. Now you can appreciate after giving the shock, the heart rhythm will slowly come. These are all the cardiopulmonary bypass circuit. So the heart is coming to the life again. So I have made this patient dead in the operation theatre for 2 hours, repaired the various portions of the heart and came back to the life. This is known as open heart operation. So see the beautiful rhythm, normally looking disease-free heart. And since lot of heparin is used in this cardiopulmonary bypass circuit, because there is no electronegativity as our endothelium is having. So if the blood comes in contact with these artificial tubings and circuit, it clots. To make it in a fluid state, we have to use a lot of tons of heparin. And as you all know, the antidote of, see the life is back here, antidote of the heparin is protamine. It is the time to give protamine and reverse the effects of heparin. So the reversal of the effects of the heparin is done, and the circuit is slowly weaned off, and whatever blood is there is given back. As with all the surgeries, these drains are put for any bleeding or anything happening post-operative period, so that it will come out and will not cause the effect of tamponades. You can see these yellow wires here. These are all pacing wires which will allow me to control the various heart rates from outside. If I want to increase the heart and decrease or overdrive, so I can do it. And the structure which is created in the beginning of the operation to enter the heart is closed by the tension wiring, like an orthopedic surgeon is using to repair the patellas and other things, you know. So figure of 8 stainless steel wires are, so that ends of the sternum will unite, and patient respiratory mechanics become alright, and he will be taken out of the ventilator and can be shifted to ward and go home. Things look very simple and straightforward here, but in reality it's not. It's a very difficult operation, and lot of manpower, lot of investment, lot of energy and intelligence. Apart from that, is experience is required to achieve this heart operation. The idea of showing this thing, this operation is very well available in our state. The purpose is not to teach how to do this mitral valve repair. The purpose is to tell you are very near to the patients, very near to the society. So at least you can educate that these type of facilities are available in the Jharkhand. So take a train towards Ranchi, not towards Delhi or somewhere else. Send them to Ranchi. Let us talk, and we have nothing doing. If he comes with us with the Ayushman card, everything will be given free of cost. And if any patient is being paid even a single rupee, I will make a very serious note of it. We will talk to the patient's relative, convince them they are not educated, illiterate people from the Jharkhand. We have to educate them, tell them the serious problem of these things, so that they will have lifelong anticoagulation in the form of warfarin or acetron and do well. So these are the various CPV, cardiopulmonary bypass data. Conclusion of the operation, heart lung machine has done its job, taking the rest. Our assistants are closing the skin and the subcutaneous tissue. Shift the patient to the ICU. Patient is extubated, and the life is back. Otherwise, the mortuary is the answer. If the things are not done properly, the next answer, the way is towards the mortuary. So I put a lot of effort. I stay in the hospital after the operation is done. I don't go home. I have no commitment in the life apart from this thing. I give my 24/7 in the hospital. I come in the morning of Monday and go home on Saturday evening. 6 days I stay in the hospital only. Very committed work. Other patients, one girl I did, a very small girl, 13-14 years, congenital heart disease, LVOTO with SAM. SAM is subaortic membrane. Very difficult operation. God is great. Life is back. But the disease is such, he requires a transplant in a coming time, which we will do later on, not in this place. I will refer it to Bangalore for that. Another operation, aortic valve replacement done, like CAVT. The idea is to tell you all the operations are being done here. So you have to guide the patients that there is a way, at least. Don't discuss them or don't tell them that these operations are in the textbook or in the movies or in the films. No, it's not, it's the reality. Now I will show you one or two more operations of 1 minute, that's all. So, same operation I did without the help of anesthesia, what is known as awake CAVT. So here we have not given any anesthesia, and what anesthesia was being used by epidural anesthesia between C7 and T1. Epidural anesthesia was given, and the heart operation was done. So heart operation can be done like this, that only. If you see here, it's a CAVT operation. The left ventricular descending artery is blocked. Coronary artery disease patient. There is some problem, I think. So you can see the surgery is going on. Patient is quite awake, and this side I am cutting the left to take a saphenous vein. She is awake. There is no endotracheal tube, and she is talking. We are talking to the patient, and the operation is going on. See other side of the sheet here, the heart is opening, and this is the bypass graft, and the patient is awake. So nothing is magic. This is all science. And Jharkhand, don't think I have promised the state of Jharkhand. I am not from this place. I am outsider. This is my first visit to the Jharkhand and eastern part of the country. I promised the government and the state I will bring this institute to a national and international level, and I am doing that. So I have done so many heart transplants. So I was in Bangalore for a long time. So I did so many heart transplants there. I used to took the hearts from the Habel, some 70 kilometers from the Ranagiri area, create a green corridor and take the heart in the busy traffic of Bangalore in 20 minutes from a busy traffic of 70 kilometers by creating a green corridor. So this is a diseased heart, dilated cardiomyopathy, ejection fraction of 10%. So diseased heart is, there are so many techniques to do the transplantation. So this heart is, this surgery is done in India, in Bangalore, about 12 years back. This is not yesterday, 12 years back it is done. And the heart which was taken from the Habel, from Colombo Hospital of Habel. So this is the diseased heart. You can see it's a big heart, you know, and all the heart is dilated and there is no muscle. This is a new heart. This is the donor heart, road traffic accident which is having a death, and the donor heart. So the size is matched. There is so many techniques, bilateral and bicaval via implantation. So I am going to implant the heart back here. Idea of showing this video is that heart transplant is a reality. It is shown in the films only. There is some film of Shukmita and where it is shown that heart is given. It's not a fantasy, it is a reality, it is done. I am trying to do this thing in state of Jharkhand. Probably it will take some time because I have to take some licenses. I need support of the government also for that. So operation is done. My last heart transplant is survived more than 12 years. So if you are going to do a transplant for a man of 40, bread earning man, and if you give another 15-20 year life to the patient, nothing is more great than this. Lot of organ shortage is there in our body, in our country, but if the awareness of the organ donation is done, heart operation, heart transplant is done, it is the most easiest operation to do, but technically a very difficult and very huge setup is required to do this operation. So the message of this talk is that I have no personal interest, neither I am a private practitioner, neither I need money, neither I need practice. I want to educate the people of, I am being taken to various towns of Jharkhand. I am just telling that these operations are done in your state of Jharkhand, and the government is supporting it in the form of Ayushman scheme. Please give benefit of these operations to the society. And who are the people who are going to give the benefit? It is you people who will give. Because until and unless you guide them, They will not come. They are having a fear, you know. Even an educated man, ourselves will be having a fear. So you please educate them and tell them go to Ranchi with the Ayushman card and no money will be charged, nothing else. Only a 5 rupee OPD slip is required and this operation of multiple lakhs will be offered free of cost. Thank you very much.